Well, just a couple observations. First of all, having been responsible for running a medical device business in '93 and wrestling through all of those issues, I couldn't agree with you more that here was a fundamental healthcare crisis in which the approach was one from a business perspective totally frustrated us. I was so heartened to hear your comments about your collaboration with Senator Wyden, because I know you two guys are on relatively different planes politically on a lot of issues, to see that level of cooperation, because this is a problem we all need to solve. And from the business side, we really relate to this question of quality. The largest expense we have in business is correcting our quality problems. And when we get quality right, our costs come down and we're able to pass those savings on to our customers. But I think that many times when I talk to my colleagues in the medical field, pharma and device side, there's actually large levels of agreement on many of the things that you've proposed in your bill. Universal coverage is incredibly important. The whole idea of having standards or guidelines about care that are driven on data and driven by professional societies that understand and know how to apply those guidelines. But we have to be careful there too, because medicine requires physicians to maintain, I believe, a personal relationship with their patient in such that they can make a judgment as to whether that guideline or that piece of data is most relevant to their patient and their application. And so the devil will be in the details, but you've provided a framework upon which I think serious cooperation and collaboration can be brought together to hammer out some of those differences. I don't think that we're going to, the waters are going to part and everybody's going to walk across the sea and everybody's going to be happy at the same time. But it is encouraging, and I think from all of those of us who are deeply involved in the healthcare field, we know that if not addressed, this will break the bank and will in fact drive our healthcare down in terms of its ranking and its ability to care for patients.